Thank you so much for taking part in the Stravinsky study. What I'm going to do with this video is show you how to undertake the home dry blood spot testing kit. So you will have an envelope that arrives, and if you unpack that and throw the envelope away, you will be left with a number of different bags and some instructions. Here is your home sampling kit. These are prepaid envelopes for returning your sample, which we can put aside for now. And here is the equipment you need to undertake your dry blood spot test. So the first thing I'm going to do at this stage, now we've unpacked it, is wash our hands. I don't have a hand wash here, so I'm just going to use some alcohol gel. So this is the dried blood spot card. We will have a barcode on here and your details. What you do is open it up so that you can see all the spots, and we put that down. Inside the other little bag, we have an alcohol swab for cleaning a finger. We have a lancet and also a spare lancet. And then we have some cotton wool to use after we've done the finger prick. And then we've got a plaster for afterwards if you need that. There is also a little desiccant gel pack, and that will go with the return sample to make sure it stays safe and dry. So the first thing that we do is clean the tip of the finger that we're going to use. And I'm choosing to use my first finger there. What I also make sure is that my finger is nice and warm. If you've got very cold hands, sometimes you don't bleed so well. So you then take the lancet and you twist off the lid. That can be put aside. You can see there's nothing visible at the moment, and that because the lancet only comes out when you press. So just slightly on a side of the pulp of the finger, and there's an instruction for that if you're not quite sure in the paper information sheet. You then just put the lancet onto the finger and press through. You can see I've got a very small drop of blood there. I'm just going to put the lancet down. Now, it sometimes just takes a little bit of time for that blood to start flowing, okay? So I can massage it down a little bit to try and get the blood towards the spot, but the flow will increase as we go. So what I do is just wait a few minutes as that's coming. And you can see it takes just a little bit of time sometimes. And there, the blood is starting to come. So if you have a look at where that blot of blood is at the moment, can you see it doesn't quite fill the whole of the spot? So it's really important that we put another spot on there. This is so that I know the total amount of blood is what we are expecting. So that spot is now full. There are examples in the paper instructions where it isn't full, and if it isn't full, then it's too difficult to accurately measure your antibody test. So just massaging that down. I don't squeeze the tip of the finger too tight because that can disrupt the blood flow as well. Now, sometimes what happens is that you don't get a good amount of blood. And if you don't get a good amount of blood and it dries up from your finger prick, it's worth just using the cotton wool, making sure there's no more blood flow, and trying a different finger, potentially after going to wash your hands in some warm water to try and improve that blood flow. So you can see my spots are coming together nicely now. This one's a little bit short. I haven't quite made the circumference, so I'm just filling that one up again. And so this whole process can just take a few minutes whilst we rely on blood flow. Now, if possible, it's really good if we can get all 8 of these spots filled. And the reason why that is useful is, although it only takes a few spots to do your antibody test, it's useful if there's any problem in the laboratory to be able to repeat that test. And so everything that you give us will be saved, and we will be able to then reuse that spot if we need to do any further testing. So what I'll do is continue with that, but for the sake of this video, I'm going to assume that I have filled all of those spots. What I then do is, you can see by the time you're bleeding well, it does just continue. And so I then squeeze together my finger and where that lancet was for approximately a minute or so to try and stop the blood. Now, it's not that painful, or I don't find it painful to do a dry blood spot test and a capillary prick like that. Some people do find it a little sore, but it is just temporary. And then afterwards, you can get a little bit of bruising around the site, but that settles within a day or so. And then when you've finished with that, you can then just use your plaster to make sure that you keep the area nice and clean. So we've then got our dry blood spot card. Remember, I would like you to complete all of that card, but just for the sake of time, I've not done that today. What I then do is put this aside for about half an hour. And what that does is it allows the blood spots to dry into the card. So when it is in the card, it's completely safe like that, unless it gets wet. So let's assume I've let that dry for half an hour. I then tuck underneath there, it says tuck cover here, and your label will be on there. What we then do is go to our specimen bag, and that says UN 3373. I then put that safely in there with the little desiccant bag. Now, it is a sealed bag, so it should remain nice and dry, but that desiccant just makes sure that is the case. You remove the sealant and put that aside. And then if you just rub across the top, your specimen is now really safe. We then have a labelled and prepaid for envelope. So you then put your specimen number, your specimen bag, into the return envelope, and again remove the seal cover and then pop that down. Now your sample is then safe to put into the post. Thanks for listening. If you have any questions at all about this and the video or the information sheet is still not clear, please contact the Stravinsky team and we're able to talk this through with you and give you some help. Good luck.